This is a story about a new mobile idea which we as a group has come up with. To start with, I would want you to listen to an audio file, and then we'll have a discussion on this a bit later. So, so, as although this audio is a bit of in Indian language, and uh, let me translate it to you. So basically, this is a kind of a personal story, wherein this is a story of my son who's just 8 months old. We as a family are happily enjoying life with him. Suddenly, he starts falling ill. Every third day, he falls ill, and he has very high fever. We have seen so many doctors, starting with the doctor who has been seeing him since his birth. Unfortunately, we spend so much money as well doing the same test again and again as we go to see different doctors because of very less or no relief. Everywhere we need to carry all the documents, but unfortunately, maybe because of stress or maybe because of something else, we miss on at least one, two documents every time and had to go on the doctor at least twice. Thankfully, after some 2, 3 months, one doctor got to figure out the issues and he is doing good. What we got to know is during the birth of the baby, doctors did mention the issues that may arise, but in as we laymen will never know or remember them. Hence, the new doctors did not know at first hand. So this primarily gave me a thought that when when the problem is being seen to for the public at large, then what kind of problems people do face. Thankfully, like I had certain resources wherein I could afford many doctors, but there are so many people in India who are not readily uh, able to afford so many doctors, so many tests, and on top of it, the child gets a lot of issues. So, primarily, what this kind of issues builds to, they primarily build into stress and discomfort, not only for the child, but for the parents, for the entire family. So, in order to summarize this, the real problem is for infants, the diagnosis becomes very tough because if you go to the same doctor again and again, getting for the same problem, then one or other doctor suggests few tests. From a parent perspective, you need to reiterate the problem to so many doctors whom do you visit and with proper documents, which is a hassle. Third is repeat medical tests, which is a hit on time, money, and health as well. And fourth, above all, is stress for the child and for all the family members. So, why this big problem is such a big problem? So, let me give an example. Every day, around 80,000 children are born in India, out of which close to 43,000 are born in hospitals. Till this point, there is no problem. The problem starts when we get to know that around 17,000 infants die every day in India. The reasons for this could be many. Maybe the steps involved in treatment are just one or two more than what could have saved them. Let me trickle down the problem to the capital of India, say Delhi. On an average, 1,000 babies are born every day. Out of this, 871 are born in hospitals, and at the same time, 341 infants die every day, which is as high as 33%. It is really sad. Uh, so the solution is, as we have mentioned, there are three key parties which have come together. So the government, the doctors or hospitals, and the parents. How? and what kind of benefits they get. The government, so there is a unique wave, as like creating social security numbers in USA. There is a method called Aadhaar system in India. So government has been trying to get everyone registered into that Aadhaar system, which is a problem for so many people. So what this idea or this thought will help them is, since the babies are born, they'll get to know uh, about a new person being born, and then they assign a particular number to that baby. From doctors or hospitals perspective, improved healthcare facilities to patients will be provided, and eventually it will reduce the steps of medication or proper treatment. Child is the biggest beneficiary, because better and hassle-free treatment in very less time will be provided to that kid. So when we see the kind of mission we have on this is, since we have highlighted all the problems, we have like given you all those details. So healthcare system in India is still like not absolutely apt. It has like so many layers, and there is no track of patient history. Every time you go to the doctor, you need to tell everything. So as a, say, as an adult, we can easily tell them that what kind of problem we are facing and all. Imagine a situation for an infant who is not even able to speak yet. So this, like when we reiterate the problem, this gets into a longer process of proper medication, and all those things happen. So how this is going to help? We are trying to create a repository in terms of an app or a mobile solution, which is handy to the consumers or maybe the family members of infant, in order to get better and quick medication. So we are trying to reduce one or two steps in the entire medication process. Third is what? So, as I mentioned earlier, it is a government generated unique ID, which will be created with the help of a hospital. And then eventually, the parents or the family can use that unique ID and a password to visit any doctor with those documents which they have. So, the entire information is uh, uh, there at in that app or maybe the mobile solution, which can be shown and accessible to parents and hence to the doctors. So the entire mission of the thing is, we are trying to create healthy ecosystems with connected data implementation across, across the multi-layered hospitals or medication processes, in order to make the kids happy, or then eventually aiming for the entire population to be happy. So how we are planning to do this is, which is a mobile first solution. It is regularly an app. So as I mentioned earlier, a unique ID is created by the government and then given to the hospitals, then eventually given to the parents with the password. So the parents go to the doctor, show this app with their unique ID and password. The doctor checks the child and it feeds in the information in that app, which is like interrelated to the computer systems as well. And whatever diagnosis the doctor has, he puts in that information, and then if parents wish to visit to another doctor or maybe the same doctor after say 3 months, 8 months, 10 months, the entire information is available to the doctor and parents again, so that it helps in medication. How do see like this is a pretty emotional subject, wherein I'm sure each and every parent will be focusing on. So how do we leverage the social media is, if we start putting the actual scenarios in terms of videos on social platforms. So not only the push part of the social platforms will gain a lot of like traffic on this, but eventually people will start sharing it, and we are expecting a lot of organic traffic on this. uh, and we can also like focus on platform, apart from social platforms, we can focus on platforms like e-com portals, wherein people start buying when they are planning to have a kid or they have a kid. So that entire process is like generated, or they are thorough with that, so that the entire problem can be justified. So hence we are looking, imagine this happens to every child today in India, and tomorrow the entire India will have facilities, access to improved healthcare, so that every child becomes happy, and then eventually, like, imagine after 20, 50, 30 years, everyone will have this kind of access and this kind of app wherein they can restore all the information. Thank you.